It is. But oncology is very high-tech biology. Let's shift gears and talk about something more mechanical. Let's look at surgery, orthopedics, and cardiology.
Right, this is where that second pillar comes in, volume. You mentioned earlier that practice makes perfect.
Think about it this way. If you need a knee replacement or a complex heart stent, who do you want operating on you? The surgeon who does one of these procedures a week, or the surgeon who does 5 of them before lunch?
I definitely want the one who could do it with their eyes closed.
Exactly.
Yeah.
China's massive population advantage creates this mastery effect in their top hospitals. Let's look at Beijing Jishuitan Hospital. It's their national orthopedic center. They perform over 50,000 orthopedic surgeries annually.
Wait, 50,000. Let me just do the math on that real quick. That's over 130 surgeries every single day.
It is an absolute factory of precision.
An assembly line, but for human joints.
Right. The surgeons there have a level of muscle memory that is incredibly hard to replicate in lower volume Western hospitals. But it's important to note they aren't just hacking away manually. They are highly integrated with robotic precision.
The reports mention custom prosthetics, right?
Yes. They use 3D printed custom map prosthetics. Instead of the surgeon picking a small, medium, or large knee off a shelf and making it fit, they scan your exact bone structure beforehand.
And print a joint that fits your specific anatomy.
Perfectly. And the result of that perfect fit is that patients are often walking within 24 hours of the surgery.
Hold on, walking in 24 hours. I had an aunt get a knee replacement in Chicago last year, and she was on crutches for weeks. How is 24 hours even physically possible without damaging the tissue?
It comes down to that exact precision we just talked about. When the implant fits perfectly and the robotic arm is making the exact calculated cuts, there is significantly less trauma to the surrounding tissue.
Less trauma means less inflammation.
Which means you get up and walk faster.
That is incredible. But if they're using high-end robotics and custom 3D printing for every patient, how on earth is it cheaper? You would think custom robotic work would cost a massive premium.
This is a fascinating economic anomaly we found in the data. In the U.S., if you look at an itemized hospital bill for a knee replacement, about 50% of that massive bill is just labor and administrative overhead.
Just paying the people shuffling the papers.
Right. The actual metal implant is a surprisingly smaller chunk. In China, those labor costs are significantly lower. The doctor's fees, the nursing, the administration, it all makes up only about 4 to 10% of the final bill.
So you are basically just paying for the hardware, not the bureaucracy.
Correct. And here's the real kicker.
Yeah,
They use the exact same international hardware.
the same brands.
Yes, Stryker, Zimmer Biomet, the exact same high-end implants you would get in a top hospital in New York or London. You just aren't paying a 50% premium for the hospital's overhead to put it in.
That makes total sense. You mentioned cardiology as well. Is the scale similar in heart surgery?
Absolutely. Take Fuwai Hospital as an example. They handle 15,000 complex PCI cases. Those are stents every single year. But what is truly fascinating here is the technique they've adopted.
How so?
In the West, a lot of these heart procedures still go through the femoral artery in the groin. It's an effective route, but the recovery is slower and the bleeding risks are much higher.
And in China, they do it differently.
They have aggressively shifted to transradial intervention. They go through the wrist instead.
The wrist. That seems like a really small artery to go all the way to the heart.
It is small, but it drastically reduces bleeding complications and cuts down hospital stays. And because they do thousands upon thousands of them, they've completely mastered navigating that smaller pathway.
And for the really high-tech stuff,